Well, we're here in Stuttgart at the conference on ethics of care in October 2013, and I'm very happy to be here with Professor Gideon Calder. Welcome. Could you introduce yourself shortly?
Yeah, I'm Gideon Calder. I'm Reader in Ethics and Social Philosophy at the University of South Wales, which is a new institution, very large in the UK.
Okay. And you actually gave a presentation entitled Caring About Deliberation, Deliberating About Care, as the theme of the conference is Deliberation and Transformation. Could you elaborate a little bit about how do you try to implement deliberation?
Well, what's interesting about ideas about deliberation is that they came from usually very abstract sources. So they came from political philosophers thinking about democracy and how it can be enhanced and refined and become more representative and more inclusive. And what's interesting about the way in which philosophers have talked about it is that they've become more and more concerned with how you would actually institutionalize good deliberation. So what kinds of settings and frameworks and environments you would need for people to be deliberating in an appropriately effective and valuable way. And it's a large part of the ethics of care as a tradition has been about that same kind of inclusion, so about including the voices of caregivers and care receivers and other relevant parties in terms of fleshing out or understanding what good relationships are, what good practices and so forth. And a lot of theorists of care actually do invoke the idea of deliberation directly in their work, so they actually talk about it as one of the things which would be distinctive about a care-based approach, that is doing this business of involving different kinds of voices in a discussion about the nature of what's going on and what should be done and so forth. But one of the things I'm interested in is that when you think about a model of deliberation, that's one thing, and how it actually takes place in practice is of course another. And that tends to bring in lots of practical issues and challenges which are actually quite hard to deal with at the level of an abstract model. So a lot of the time you find that the dynamics of how people actually talk to each other are complex and shifting and full of lots of layers which you couldn't really incorporate into a model in a very simple way, or it would be such a complicated model that it would almost be impossible to follow. But that is how deliberation happens. So different sorts of people, different kinds of shapes and sizes and backgrounds and ages and levels of linguistic competence and different kinds of capabilities in other senses, different kinds of expertise, different professional backgrounds, different roles and situations in society will all arrive in a deliberative context from quite different directions, and they will experience it differently. And so the business of actually really genuinely including all of those voices, I think, is actually very difficult. So one of the things that I talked about in my actual paper was a workshop that we run with a local authority in Newport, where one of the campuses of my university is. And it involves local authority employees who do social work, basically, along with the users of various kinds of services offered by the local authority, and caregivers as well as academics, and sometimes also the management of the local authority. And we try to run exercises where we think about certain kinds of pressing issues which are going on in the provision of social services, and think about the kinds of ethical questions that they raise. And we try to do that as much as possible on the model of a kind of deliberative exchange in the same way that deliberative democrats think about it. It's evolved that way. It wasn't our plan at the start. This is increasingly what we're trying to do. And what we find is that actually, in the way which is in some ways quite predictable, it's actually very difficult to achieve everything that seems to be valuable about deliberation because, for example, a lot of the literature on deliberative democracy originally was geared towards consensus, so it was assuming that a good outcome of a deliberative process would be a kind of unanimous position where everybody would converge and agree about what the important issues were and how we should respond to them. But in practice, what you often find is not consensus. What you find is an uncovering of lots of layers of conflict, actually, of people not agreeing about what the priorities are. And so then you have a kind of challenge about how you respond to that in a constructive way. And my own kind of sense about this is that it's probably better not to think of consensus as being the goal in the first place, not to think of deliberation only working when it leads to that kind of convergence, because then most deliberations will be failed deliberations in the sense that they probably won't deliver that kind of outcome at all. So it's how to think about the value of just finding out that there are sometimes differences and conflicts and a lack of agreement about what should be done, but still responding to that in a kind of constructive way. Care ethics is largely about people's relationships to each other and about the quality of those relationships. And it seems to me that we have to allow for the fact that there could be a very good quality of relationship even in a state of disagreement, for example, and that's okay. We shouldn't be nervous about that. That might actually be quite a helpful step on the way to making some progress in whatever field we're talking about.
Okay, so also in relation to what you said earlier, that a model is not really, can never really approach reality. So we also, in deliberation, we need to really allow for kind of diversity without thinking that it's not...
well, a good example would be, a model is useful and it's a starting point, and I can't really see how you could do something like deliberation without some kind of model. It's just that it has limits, it only takes you so far. So, for example, it would be just as problematic to have a model which was assuming disagreement in advance, because that would probably become self-fulfilling. You would be looking for diversity and discrepancies between what people thought instead of perhaps allowing for them to converge, and that could equally well happen. But the problem is that if the model either assumes that there will be consensus or its opposite, then it risks making that the outcome and not being sufficiently sensitive to the actual context, the actual kind of dynamics of how the real deliberation is playing out. So it's to have, I suppose, a model which is as open as possible as regards possible outcomes, but still geared towards seeking what's valuable in deliberation. I think